Thanks so much, Nick, for agreeing to have this interview for the UK Association for Solution Focused Practice. So we're going to talk about this book, which is Solution Focused Practice and Mental Health Crisis, Inclusive Support Towards Safety and Hope, which you edited with 16 other colleagues, I believe.
Indeed. Thanks
And
so much for asking me. It's
many
lovely to be here.
yourself and many of those colleagues presented a really good plenary at the association's conference in Bradford in July, which was very well received. And I think the book created a lot of attention and a lot of interest. So I'm looking at the Routledge page. Routledge are the publishers of this book, and your biography, it says Nick Perry is a registered social worker, an approved mental health professional, and is accredited by the UK Association for Solution Focused Practice. He has experience as an educator, supervisor, inspector, practice lead, and is a visiting lecturer at Brighton University. So what else do we need to know, Nick?
Yeah. Dedicated sea swimmer, school runner, wine drinker, all those sorts of things.
Excellent. So I sort of regard publications like this. I regard publishing and writing books, articles, blogs about solution-focused practice as very important within the development of solution-focused practice and its community and its culture. Alongside clinical practice, obviously, but also training and conferences like that. So I'm very interested in the process and the whole big sort of narrative around that. And in the introduction to this book, you gave a bit of background about the origins of this book, going back to COVID and your experiences as an approved mental health social worker in COVID times. So do you want to kick off from there and just tell us how the book came into being from there?
Yeah, of course. I've been working under the Mental Health Act continuously since 2007, when I did my training at the Maudsley Hospital, and then moved down to Hastings, where I live on the south coast, quite quickly, and was working with a crisis team, and I've kind of continued to work in adult mental health settings. But of course, the statutory work under the Mental Health Act, we work with all ages, and it's been a journey, a work journey for me that has had some periods when I've been quite tired and I've wondered if I could carry on. And the pandemic ended up being, if you like, the kind of the biggest stress point in my statutory work, mainly because there was so much uncertainty. There was a little bit of fear around people's safety, but as mental health professionals, we were needing still to assess people's mental ill health, despite lots of other colleagues shielding. And my workload kind of went through the roof, really. The number of assessments I would usually do doubled, and I got really worried for my own health and safety. Got to the point of thinking, actually, I'm not sure if this is for me anymore.
So Nick, for those who aren't so familiar with the approved mental health professional role, do you just want to say a little bit more about
of course.
what's the most stressful elements of that role then, and what's the challenge?
Well, we are, one of those statutory workers that are looking at risk at its sharpest point. The Mental Health Act is concerned with people who may have a mental disorder, and the risks to themselves or others are such that compulsory admission to hospital needs to be thought about. And the process is that somebody a doctor in particular, who knows the person well and a second doctor with special expertise in psychiatry, and then a third person, an independent person who isn't from the medical model, is supposed to provide some scrutiny
Yeah.
to the decision making, and that's the role of the approved mental health professional.
Okay.
And from 2000, I mean, previously this was an approved social worker, originally under the 1983 Act, and then the amendment in 2007 extended the possibility of undertaking this training to other health professionals, including mental health nurses, occupational therapists, psychologists, but not doctors. So
Yeah.
there's a requirement for approved mental health professionals to try to find any viable, safe, less restrictive alternative than compulsory admission. That's the bread and butter of the work.
Yeah.
Um,
Okay.
and
So,
the
sorry.
yeah, I was just going to say, and the so to kind of come back to the beginning of your question, this work was still needed, obviously, and you can imagine that people's mental health was significantly affected by the pandemic, and isolation and separation, and being out of work environments and all sorts of things, adding additional stress and pressure. And I got to the point of thinking, oh, I don't know if I can do this anymore. And my boss said, well, look, lovely lady, thank you, Jenny, said, is there a training course I can send you on that's going to keep you doing it for a bit longer? And that's how I came back to solution focused practice.
How did you choose solution focus rather than any other training course then? What was your
Yeah,
connection?
it's a good question. I prior to doing my my AMP training, I had started a family therapy training at Kensington Consultation Centre. I was working in London at the time, and I got really interested in the ideas of Jaakko Sekula and the Finnish mental health professionals that were working on open dialogue.
Yeah.
And I got really interested in systemic work in adult families because adult social work has been my background. And of course, family therapy tends to look at families including young children or children rather than just solely adult families. And then I had also had an experience of grief around about 2014 when I went and did a supervision course, solution focused supervision with Harvey Ratner, because I'd got to the point in my career where I was supervising quite a few social workers who were a lot longer qualified than me, and sometimes a little bit tricky, dare I say it. And I felt like I needed a bit more expertise in supervision. And I saw this course advertised and I went along to it back in the day when courses were face to face and not online. I did 2 days in London and I found it really, really useful. So when Jenny said, oh, go and have a think about what kind of training you want to do, I was already predisposed to thinking about solution focused practice, and one of the things that was so attractive about it was the possibility that a single conversation, a single intervention might be worthwhile, might become useful. And of course, as approved mental health professionals, we often just have one snapshot opportunity to meet with people. It's not a long-term piece of work. It's going into usually a crisis situation and trying to make helpful, supportive decisions alongside people. So it felt like it had a bit of a natural fit.
Yeah, well, that's really interesting. So your practice is in a really challenging environment, really challenging situation, and so you must have had a strong feeling that there was fit here between what you're trying to achieve as an approved mental health professional and solution focused practice. So from there, how did things develop, and where does the origin of the book?
Okay, so I mean, I think what's interesting is that quite quickly I realised that because I went back to Brief and I did the online certificate and then the advanced certificate with them. And of course, Chris Iveson and Evan George, who were leading that training, are teaching solution-focused brief therapy. And so I quite quickly had to start to think about the application of the teaching into my statutory role, because I'm not essentially doing therapy when I'm doing my job. But I started to think about the possibility of being able to hold the statutory responsibility and the potential for a therapeutic conversation together in parallel. And it was quite hard to get my head around it. But when I started to try to do it and began to see the new information about strengths and capability that people were able to share, and saw the way that I could then balance that information with perhaps all the more problem focused information that came through a referral or that was recorded on a social services or mental health trust system, and I could come to a more reasonable risk assessment and co-produced plan for what we do next, then I got really excited. And I thought, well, I have to share this. You know, I have to tell people about the possibility of working in this sort of way. And that was the beginning of the idea of the book, really. My personal relief, actually, that I'd found a way of being potentially a useful intervention for people at a time when, with my statutory responsibility being to try to find least restrictive alternatives to compulsory admission, and the NHS and local government social care provision was more and more stretched and potentially more and more broken, there was less and less to offer. And then I found a way of being able to offer at least something. It was a huge professional relief. And given that the role of the AMP involves so many potential different partner professionals, it felt the natural progression to wonder whether or not, if we all had a solution-focused approach to the work, then perhaps we would be in a better position to support people, because often people in crisis come into environments of statutory care where they're talking to people from very different professional backgrounds who have a different language, maybe different drivers systemically, and it can be quite confusing to understand what's going on, especially if you're unwell. And the notion that we could all be speaking a similar language, even though we're from different backgrounds, was struck me as potentially quite seismic, actually, in terms of the experience of the system for people who are in crisis and who are unwell. So that was also the basis for the breadth of the contributions, really, because I could see from my own professional standpoint all these other agencies that I'm involved in or involved with day in, day out, that could start to know about solution-focused practice.
So it's a really, really important point. So you start from your own practice and look at the wider network of professionals, and it's the contributions include. We'll talk about the contributors in a minute, but the contributions include reference to police work and psychiatry and self-help groups amongst people with mental health difficulties, whole variety, a real spread, suicide prevention, staff wellbeing as well. So one of the key things that comes through in the book is the importance of anti-racist practice and how SF is really consistent with that, and the being the inclusion of minoritized people's voices in their own treatment plans and the like. So would you like to speak around that, because that seemed to be a really important part of the fit for SF and solution focused practice and what you were trying to achieve?
Yeah, I mean, I don't know if folk will know, but for the last 40 plus years, probably even as long as the Mental Health Act has been in existence, and even before that, the statistics around compulsory admission show that we have a disproportionate number of people of colour being detained. And whilst we've known about that ever since kind of Christopher Clunas and the early inquiries, we haven't seemingly been able to shift the picture. And I mean, folk who are subject to community treatment orders, that which is the part of the Mental Health Act which says you've got a mental disorder and you need treatment, but you don't necessarily need that treatment in a hospital setting. You're 11 times more likely to be subject to a CTO if you're black. So there's whole discourses around the cultural implications of assessment, dangerousness, all these things. And my instinct and my great hope is that solution-focused practice can be an ally in terms of anti-racism within the mental health system. And and being a post-colonial country, we have systems that are institutionally racist, and we just have to be honest about that.
Yeah.
And take responsibility for it and try to change it. And I think I said in the book, we're not setting up solution focused practice as a panacea in respect of anti-racism. I'm sure the approach, and also people working under the approach, could be more overtly anti-racist. But the way that I took a lot of inspiration from Mo Yi Lee's writing in America around intercultural social work, and the way that we come to conversations from a not knowing position, and we prioritize the expertise and the voice of the person that we're meeting with, lends itself to co-producing knowledge, lends itself to having a platform for people to start to talk about their own strengths, the strengths of their community, and the way in which they want to see themselves recover, that that can not only be described in their own words, but will bring knowledge that somebody from outside that experience could never have. And I've always had I've got an internal Chris Iverson voice that is in my head. I don't know if he knows this, but I do. And it says things to me every now and again, not in a kind of a psychotic way, hopefully, but in a things that I remember him saying, such as solution-focused practice can help people to say things out loud that they know, but they've never heard themselves say before. And if that's one of the most powerful impacts of solution-focused practice, then to be able to say that with all the wealth of knowledge of yourself, your family, your culture, that's hugely important.
Absolutely. Yeah. Thanks. So tell me about working with these 16 contributors then. You somehow reached out and pulled them all together. And I think one of the nice things reading through the book is the sort of cross-referencing from one writer to another. Now, they are largely part of the community already, so I guess a lot of them know each other and know you. So tell me, how was it working with this team then?
It was really lovely. It was a lovely experience, and you're right. A lot of the people contributing may well have known each other much better than they knew me, because I was quite new. I was a newbie, really, in terms of
Mm.
um, learning, training, starting to practice. And I kind of saw that a little bit in terms of the vision of the book as a benefit, because I wanted to try and convey my own journey to readers, so in a way that
Yeah.
could feel as though if I could do it, they could do it,
Yeah.
kind of thing. And I ended up realizing that there were quite a lot of parallels between the role of the approved mental health professional in terms of gathering information, gathering colleague collaboration, um, and the role of an editor. It ended up being
Right.
quite a similar process in
Oh,
some
okay.
ways. That you need to make sure people have got the information that they need, and help them to get to an endpoint, uh, along the way. So there were quite a lot of similarities, which I hadn't anticipated before I started the work. And I suppose what was, I mean, I'm really grateful for the kind of both the generosity and the efficiency of my co-authors in terms of their contributions, because it was being able to have work quickly and talk about it, and send versions between each other, and all the time getting different pieces from different people helped it to be possible to connect people up,
Mm.
really, in terms of the way that they were writing, and to offer the individual authors little opportunities to quote each other,
Yeah.
as the book went along, that hopefully has made for a coherent end effort, really.
It does indeed. It does indeed. And there's too many contributors to run through by name. One thing it always impresses me is the seems like the process of writing is almost equally important as the final product to some degree, and having to distill practice wisdom into a communicable form in the written word. I think does generate new knowledge, and it also is influential, isn't it? I mean, we all have our favorite SF books that we've learned stuff from or copied stuff from, or has influenced our practice. So I'm wondering what else did you learn as part of the process of pulling this all together?
Well, I mean, the the way that we live and work now, with a lot of computer, a lot of phone, a lot of screen time, really has, uh, I realise, kind of shortened my attention span, um,
Right.
and I've really valued in my learning, and wanted to replicate in the book, um, really pithy, easy to read work that has practice stories to show you what people are talking about.
Mm.
I've, uh, I think probably I've got Chris's voice in my head, because I like the way that he writes and the stories that he tells. I mean, maybe social workers are kind of predisposed to enjoying stories.
Storytellers, yes. Yeah.
Um, so, there've been a few articles, the White Cube, Leaving No Footprints. Those articles have really stuck with me, and I was really hoping that we could produce a book together that wouldn't be too big, that people could put in their bag, and that they could dip into as practitioners in between visits, or if someone was late, or and the contributions themselves. I mean, we started off with an idea that people would write around 3,000 words, which was going to be a shortish chapter, and largely we've stuck to that. So that they're bite size, and maybe if you had time you could read 2 or 3, but sure, it would be reasonable to read 1.
Yeah, going back to your point about the common language, near the beginning of the book is Guy Shannon's chapter on extemporizing SF, which I thought was a really good piece of writing. Guy's published quite a lot, but and this is really nice to link, beyond formal settings, in that even although I've forgotten the phrase now, but even a single SF related question or invite to a conversation may be effective, and that's something that any practitioner within a network can pick up. I was also really taken with Emma Burns' article about the use of SF language within the police setting. Police personnel often being first on the scene where there is a mental health crisis in the community, and the effectiveness that can have. That demonstrates Guy's point, I think, very, very well. And Rod Gould and Mark Kilby's discussion about mental health self-help groups as well was also very inspiring. And that's just to be unfair and pick out a few.
Yeah, but no, I mean there was lots that I really enjoyed, and Guy's, I was really pleased that Guy was willing to write his chapter, because that's one of the things from my statutory work that has been most important in this process, that we won't necessarily as practitioners have the chance to have a very full classical structure solution focused brief therapy conversation with someone. We might even only have 5 or 10 minutes where we can be alongside someone, and in that time solution focused questions can help us build rapport. They can help us understand what somebody's priorities are. They can help people to begin to say things out loud, which they can then potentially repeat in an interview with different professionals, including people with medical power. And it helps self-advocacy, I think, as a process. So it was really important that we describe the way in which, even if you have a short time to ask only a few questions, then that can still be useful.
Well, I really like the term self-advocacy. I think that's really interesting perspective on that. There were, in the conclusion, you mentioned that you'd really like to have a few other chapters in there as well. So who else would ideally you'd have liked to include?
Yeah, well, there was a bit of a confessional at the end to say that we didn't cover everything, for sure. Just realizing through some of the work that Lauren Jerome has talked to me about, that it would be really great to kind of reach out to GPs across the country and help them to know about solution focused practice. I know that there have been GP colleagues in the past that have written about their use of SF in GP interviews, which again by their nature are quite short, and how that can help them to be really efficient with their time in consultation. Mentioned people that might have learning disability and also mental health needs. We didn't really have a chapter that focused specifically on their needs and the way that the approach might need to be tailored. I think that's the point, really, that even though we might not have had full coverage, for example, we didn't have a chapter for people experiencing dementia, what we know about solution focused and the way that it's evolved from an English language speaking therapy is that with determination, the approach and the questions can be applied and changed to fit the particular environment or culture in question. And one of the final comments I make in the book was my remembering an assessment of a young man who was profoundly deaf. I'm hard of hearing myself. I sign a little bit, but not very well. I lip read. And my experience of working with relay interpreters in under the Mental Health Act, and I don't know if folk know what that means. So relay interpreters are people that are also born profoundly deaf and can interpret the signing of people that equally have been born profoundly deaf in a way that hearing British Sign Language interpreters aren't able to do. So they're able to sign from the deaf person to a British Sign Language interpreter who will then interpret to the involved professional.
And recognizing language cultures, isn't it, rather than a straight translation?
Exactly. And what I found was that I would ask the best hopes question, and people would go like, what does that kind of mean? And we didn't have the time in that setting to go through the nuances of questions and the syntax is different. And if from British Sign Language, kind of word order is different. So these, I suppose I have a confidence seeing the way that SF is used right across the world in different languages. Then we can find a way to do it. It's just that I couldn't do it at that point.
Well, indeed, there's a developing literature, huge developing literature about the use of SF in China and Southeast Asia and a number of other countries where the language cultures are quite different, really. So one thing that I'm aware of, you referenced changes or amendments to the Mental Health Act. And I understand that the Mental Health Bill is currently at report stage, having been through the Lords. It's in the Commons at second report stage. And that there's going to be additions to the codes of practice that are entirely consistent with a solution-focused practice. Do you want to say a little bit about that?
Well, there's work to be done to kind of make that happen. But from my own professional point of view, I really see that the way that the code is to change could be benefited by including this work. Really, there's an encouragement for approved mental health professionals in the code as it stands to spend time alone with people, so that they have an opportunity to have the support of somebody independent who can help them think about where it is that they want to get to in terms of the immediate distress they're experiencing and potential plan of recovery. But there hasn't in the code been any direction as to how people should structure that time alone. And I think a solution-focused approach to the time alone is potentially really very helpful for AMPs. The training, the post-qualification training, has up to now had a very legal lens about it.
Yeah.
because you need to be, and will still need to be, the expert on the law in order to ensure that people's human rights are upheld, that least restrictive ways of working are prioritized, that all the different partner professionals in the process are doing what they ought to be doing. That's still important. But what hasn't been done in the training over all the time that people have been trained for the role is people haven't been given the kind of therapeutic communication skills that would be helpful.
Yeah.
There's been a kind of a tacit expectation that the professional expertise and training that you've already had, you bring to the role, and you're already able to do that. And I really believe that solution focused practice has got a lot to offer in the pre-warrant training and continuing professional development of AMPs to help them maximize the time that they have with people, and to bring this new information about strength and capability in a way that can really help with risk assessment and robust defensible decision making.
Great. Okay, final area for our conversation. I just really want to know what's been the impact of the book so far.
Well, it's I think it's still early days,
Early days.
honestly, Tim. We published in June. I spent some time trying to Netflixize the arrival of the book on social media. I was trying to give tasters for people along the way to help with the momentum of the book. It was brilliant to have the opportunity to come and talk about the book at the Bradford conference for UK SFP. We've had a wonderful review in the Journal of Solution Focused Practices from Mark McCurgo. There's another very helpful and supportive review from Professor Dennis Ugrin at Queen Mary, London, coming out in the British Journal of Psychiatry soon. Hopefully there'll be a piece from Daisy Long in Professional Social Work. And the benefit of having lots of collaborators, lots of co-contributors, is that hopefully we get a wider range of networks to access as well. I'm involved in the AMP Leads network, trying to do some work on the code over the next few months with Robert Lewis at the Department of Health and Social Care. Very much hoping that I'll get a message later today about applications for a new solution focused practice in health and social care settings module at Brighton University. That is going to start at the beginning of October, we hope. And I've been given the green light to write a follow-up book for Routledge, honing down on solution-focused practice for AMPs. Right. We've got a kind of a beginning chapter in the book here, but I've kind of kept an anonymized record over the time since I started the training with Brief, which is 4 years or so now. 4 or 5 years of times when I've used the approach and felt the potential impact, and that's over a range of different assessment scenarios and different settings for AMPs. So fingers crossed we'll have a new book this time next year.
Excellent. Well, I really, really hope this, book one has significant impact and builds up some momentum behind it, and we could see the beginnings of that at the Bradford conference. And I think we'll really look forward to reading reading book two and seeing how that influences the wider practice as well. So, thanks very much. It's been great. Great talking.
Really grateful for the opportunity. Thanks, Tim.